Hello, we've prepared a presentation to give you an overview of the use of biometric technology in healthcare and how it's more than just convenience for the users and patients. This presentation was prepared by Shannon Baum, Courtney Buckman, Kyle Horn, Grace Meyer, and Jeannie Poon. During our presentation today, we will cover the topics of cost effectiveness, accuracy and quality, security, possibilities, connectivity, and user acceptance of biometric technology in healthcare.
We have learned through the course of this class that technology equals convenience. Through our readings, our studies, and numerous discussions, we have touched on the many ways our lives are impacted and made much easier due to the advances in technology. I could order my usual latte via my mobile app, make my payment, access my loyalty rewards, and pick up my order all within a matter of minutes, and all from the convenience of my phone. If I'm going to Disney World, I no longer have to stand in the long lines of the security checkpoint, as I no longer need to carry my purse. Everything that I need is stored on my Magic Band, from my theme park tickets, my fast passes to my pre-scheduled rides and attractions, my dining reservations, payment capability, and my hotel key are all stored conveniently on the band on my wrist. If I need directions to get to Disney World or any other location for which I am not familiar with the route, I no longer need to study a paper map. I simply speak to the voice-enabled app on my phone, and the Bluetooth will give me step-by-step directions guiding me to my destination. How convenient! In healthcare, gone are the days of trekking from facility to request and receive hard copy records. The long waiting period of obtaining records and delivering records have vastly improved through electronic medical records. Everything that the provider needs, from my personal information, my history, my labs, my test results, everything is available almost instantaneously once they have scanned my palm. So what is this scanning technology? It's biometric technology. Biometric technology confirms the identities of individuals through physical attributes such as fingerprints, palms, eyes, or faces. By having accurate and timely access, providers can provide more accurate care and thus increase the quality of care that is available. And this biometric technology is what we want to explore.
Health systems are investing in biometric technology more than just convenience. It's about quality and safety to their end users and to their patients. For health systems to incorporate biometric devices, it's getting less and less expensive due to widespread implementation and an increasing rate of adoption. Increased adoption of biometrics has made it more affordable for companies to buy and to make these investments. Prices have dropped for the following reasons: economy of scale, increased production of these devices, and electronic components are cheaper to make the actual devices. One of the most noted products where prices have been slashed is the iris image, facial recognition, and the fingerprint recognition system. Investment into biometric technology is twofold. One, the investment into the product, and two, the investment into the safety and security of the patients. Security measures are the most important because of the patient data and the health information healthcare facilities have access to. Healthcare sector is a great big target for hackers, and they can be extremely costly to the hospital system if you have a breach of information. One of the most known acts is HIPAA, Health Insurance Portability and Accountability Act, and it has notable cases that if you don't have the proper security measures put in place, it could cost a health system millions of dollars. By adding to biometric devices, you limit these risks. Many of the cases involve not secure passwords for protected devices and poorly managed password policies. Passwords that are weak or stolen or created can cause major issues for the organization. So if you invest in biometric technology as a tool for passwords, it could increase your security and minimize the risk and ultimately the extreme costs that come to the healthcare system. Biometrics also eliminates the duplicate patient records, which can be extremely costly as well. According to the article, How Biometrics Can Improve Your Health Security, the cost to resolve one duplicate record is $50 per record. For a big health system that has millions of patients, think how costly this could be. By implementing biometric technology, facial recognition, or fingerprint scanning, you can eliminate the duplicate records. Also, a contaminated record is costly. This means a medication error could occur. Humans are doing this type of work, nurses, physicians, and so that's always a possibility. So any kind of security method you can put in to eliminate the human factor is a step towards saving your organization money. If patients were fingerprint or scanned prior to be given to the medication, this could catch these costly mistakes before they were major incidents and newsworthy events.
With the implementation of biometric technology in healthcare, accuracy has increased greatly across many areas. One specific field that may be overlooked is patient identification. The World Health Organization actually named patient identification as one of the key areas in healthcare where improvement is urgently needed. This is because so many major issues can occur with the misidentification of a patient. Mistakes in patient identification can result in medication errors, transfusion errors, testing errors, procedures done on the wrong individual, and even the discharge of infants to the wrong family. In fact, 67% of blood transfusions go wrong due to an error in patient identification. However, with biometric technology, patient identification is much more accurate, and these errors are significantly reduced. Along with accuracy, the quality of healthcare also increases with the implementation of biometrics. The quality of care given, as well as the patient's quality of life, are greatly increased. Biometrics allow for typical processes to run at a more seamless level. The errors are virtually taken out of the process, which allows for more successful treatments to be had. And this is why the quality of care is increased so greatly. Accuracy seems to be the common theme with biometrics, as it does allow for that error-free medical care, and it also gives the patients a peace of mind about their treatments. Coupled together, this results in a higher quality of life for the patients.
When it comes to security, biometrics can be used to prevent medical identity theft, healthcare billing fraud, hacks, and unauthorized access to patient records. To start, medical identity theft occurs when one person uses another person's name or health insurance to obtain medical services and prescription drugs or file false insurance claims. Medical identity theft affects many people every year, and impacts include an exhaustion of benefits, a loss of health insurance, lost time, and an inability to access one's own medical records because of privacy laws that ironically protect the thief's identity. So where does biometrics come in? Biometric scanners can be used to confirm patient identities. As you can see on this slide, Florida Hospital, which has nearly 30 facilities across the state, started using Patient Secure's biometric scanners to reduce the risk of medical identity theft. By linking a patient's palm with his or her medical records, Florida Hospital can confirm whether or not the person seeking care is actually the person listed on the insurance card and to whom the medical record belongs. Now let's turn to a form of healthcare billing fraud known as phantom billing, which occurs when healthcare providers submit claims for medical services that weren't performed or weren't necessary. The DOJ news release pictured on this slide provides an example of phantom billing. In this case, a physician billed Medicare and Medicaid for physical therapy sessions that were never provided and received over $200,000 as a result. But healthcare billing fraud isn't just costly in terms of money, it's costly in terms of health. For example, a cardiologist from Chicago performed 750 unnecessary heart catheterizations, which caused the deaths of several patients. While biometric technology can't solve the problem of doctors giving out unnecessary treatments or misclassifying diagnoses, biometric scanners do give insurance companies and healthcare providers a way to verify a patient's actual presence at a healthcare facility. If these scanners are set up at patient entry and exit points, the actual time spent at a facility will also be recorded. If physicians know that the presence of these scanners could contradict their billing claims, they will be less likely to file false claims. Biometrics can also be used to prevent data breaches and unauthorized access to patient records. Unfortunately, hospital systems containing patient records are so prone to hacking for two reasons. First, patient records are very valuable for hackers because they contain so much personal information that the hackers can turn around and sell for a high profit. Second, most patient records are protected only by easy to steal or crack passwords. Since biometric authentication mechanisms rely on information such as human palms that can't be stolen easily, adopting such technology would enable healthcare providers to more effectively safeguard patient information. It's important to note, however, that data breaches don't just come from the outside. Almost 40% are committed by insiders, but biometric technology can effectively combat insider threats. Biometric scanners would allow only those doctors, nurses, and other individuals involved in a patient's care access into a patient's records, thereby enabling hospitals to ensure that their employees are complying with government regulations such as HIPAA. Lastly, biometric authentication tools could be used to allow or prevent access to certain locations at a healthcare facility, such as a medicine room.
CVS recently made a decision in September of 2017 to begin limiting opioid prescriptions to certain patients to help fight the devastating opioid epidemic that is affecting our population. CVS will limit supplies to new patients being treated for acute ailments. CVS will also limit the strength of the opioid being dispensed and will contact physicians if the strength of the medication seems to be too powerful for the treatment that's needed. These steps are being taken because of the loopholes and weaknesses for patients who have abused the prescription medication system and thus caused a serious epidemic that has had serious and deadly consequences. Biometric technology could vastly improve the situation and tighten up the weaknesses that pharmacies face. Biometrics could be used to correctly identify patients that perhaps are abusing the system, or could trigger an alert if there is a patient that is pharmacy hopping. Biometrics would also help cut down on the likelihood of falsification of records in order to obtain the prescription meds through the impersonating of patients through stolen prescriptions or inconsistencies to the frequency that the prescriptions are being filled for the same patient. This is just one aspect that could help remedy the challenge in ensuring that those patients that need the medications are getting it. With the prevalence of electronic medical records in all facilities and the connectivity of these electronic records amongst clinics, hospitals, doctors' offices, labs, and surgical centers, the use of biotechnology will help round out the last component to create an efficient information system that will revolutionize healthcare. With just a touch of a finger, palm, or the picture of an eye, patients will be easily and quickly identified, the correct medical record accessed, and the sharing and reviewing of information will be almost instant. Patients will be able to walk up, be biometrically identified from facility to facility, creating not only ease, but achieving accuracy of information. The time savings offers greater face-to-face time between the patient and the physician and allows for better collaboration between healthcare providers. And all these components lead to better healthcare for the patient.
In order for healthcare systems to successfully implement the use of biometric technology in their offices, they have to gain acceptance from their staff and patients. The biggest factor in doing so is educating them on the benefits that biometric technology bring to patients. Many of these educational topics were covered throughout our presentation. Stressing the added convenience this new technology offers patients is almost guaranteed to help gain support. People now are busier than ever and look to find the quickest and easiest way possible to get tasks done. As Jeannie mentioned, gone are the days of trekking to and from various doctors to get medical records, now that they're all stored online. However, this can bring up concerns of security for patients. Biometric technology offers more security to these very personal records than the simple passwords and patient PIN numbers that have been widely used until more recently with the introduction of biometrics. According to an article published by NBC News, 80% of people prefer biometric security measures to traditional passwords containing numbers and letters. This means that people are already accepting this technology in their lives and have mostly positive reactions when they see it used during visits with their doctors. Security measures are extremely important for healthcare offices because of the threat of hackers to their systems. Educating patients about the fact that this use of technology requires approval from HIPAA will help them feel more at ease with the safety of their medical records. An additional area where patients can be educated is around the safety the technology provides to their health. By scanning a fingerprint, palm, or iris before operating on or providing care to a patient, there is less room for error in treatment, meaning a doctor won't miss something due to duplicate records or provide care for one patient that was actually intended for another. At the end of the day, patient acceptance relies on the patients themselves. A patient has to be willing to give up a little bit of privacy in order to gain better security. And therefore, the more you can educate them about the benefits, the more accepting they will become. Healthcare industries are rapidly accepting the use of biometric technology. We hope that you learned something new today and that next time you visit your doctor, you'll take a look around and see how they're using this technology in their office. We bet you'll see something.